Hello, everyone. Hello, everyone. My name is Rajvee Shah. I go by Raj. I'm a cancer rehab, lymphedema, and pelvic floor physical therapist. I'm a cancer survivor myself. I am based out of Pittsburgh, Pennsylvania. Based on my expertise in helping cancer patients over the last several years, and being a cancer patient now myself, I wanted to spread awareness about how we as cancer patients can help ourselves when we find that diagnosis to be positive. I know we have fantastic medical team, doctors, nurses, everyone in the medical field to help us survive once the diagnosis is positive for us. But what can we do as patients to help ourselves so that we can embark on this journey with confidence and with a lot of knowledge and come out stronger than ever? I hope that these series of pre-rehabilitation lectures can help you thrive before, during, and after your cancer treatments instead of just surviving. So let's start with it. This is a short medical disclaimer. I have tried to do as much medical research and article research as possible to bring this presentation, but I want you to be your own guide. I want you to do your own research and find out more and more trusted resources so that you can help yourself better. I wish I had known about this before. I wish somebody would have told me about this. I wish my doctor would have mentioned about it. I have heard these remarks over and over again every time I see a cancer patient for physical therapy later in their journey. This was the reason why I really thought that awareness and knowledge of pre-rehabilitation should be out there, and every patient who gets positive diagnosis of cancer can start helping themselves from the day they know about their diagnosis. I preach the principle of prevention is cure. By knowing the right components of rehabilitation, before the treatments begin, we can already prevent functional deficits, mental disorders like depression, anxiety about the upcoming treatments. We can prevent deficits in our joints and our strength by making ourselves physically stronger. We can prevent conditions like lymphedema by assessing them early on. And hence, we want to know what is pre-rehabilitation and how we as cancer patients can start helping ourselves from day one. I really wish that we embark on this journey with a lot of confidence and not just crawl into it. So, this is a little bit about my own cancer journey. I was diagnosed with cancer in August of 2023. I had bilateral mastectomy in September of 2023. So, from the day I knew about my diagnosis to be positive, being the physical therapist, being a cancer rehab specialist, I already knew how I'm going to prepare myself for this journey. So instead of succumbing to fear, instead of feeling depressed and anxious about everything that is going to come up for me, I started working mentally and physically to prepare myself. And it helped. It helped me so much. It helped me have almost no functional deficits. It made me a much stronger and resilient person. I was able to go through treatments a lot more gracefully, and I'm a more confident and stronger person myself. And I want you to be the same. So I'm going to talk about pre-rehabilitation in series of 6 lectures. This first lecture is going to just give you an introduction about what is pre-rehab. If this word is new to you, you have never heard of it, I'm going to break it down for you, and then we are going to go on several components of rehabilitation that you could start doing whenever you are ready to start helping yourself. So what is pre-rehabilitation? Pre-rehabilitation is basically boosting your mental and physical abilities before the start of the treatment by introducing components of rehabilitation prior to beginning of your medical treatment. You are already improving your chances of faster recovery, more confidence, and better tolerance to all the medical treatments. It could be all the treatments that cancer treatments involve. It could be surgery, radiation, chemotherapy, immunotherapy. It could be combination of all of that, or maybe one of them. In spite of what your medical treatment involve for your cancer journey, pre-rehab principles stay the same. You can do all of these interventions no matter where in your cancer journey you are. I'm going to break it down into few small components for this lecture, and then we're going to start picking up one component at a time, and we're going to work on that. I always compare a cancer patient to a marathon runner. They both are elite athletes. A marathon runner, the day decides to run for the marathon, starts preparing the body and the mind so that they can last for the entire duration of the run. Our cancer treatments are somewhat like that. We need to embark on this journey with good mindset and good physical abilities so that we can also last longer. Cancer treatments do demand a lot of strength, resilience, and endurance because it is not a one-time treatment. They are repeated procedures, maybe repeated surgeries, several rounds of chemotherapy, combination of chemotherapy, radiation therapy, etc. And this is very similar to running a long marathon, maybe an ultra marathon. Hence, we need to be better prepared mentally and physically to get going on this journey. I also compare going through cancer treatment like building a house. Just when we decide to build a house, we start from a strong foundation. We have a plan. We start bringing the materials together, and then we start building that house layer after layer, brick after brick. Similarly, if we know about our diagnosis, a medical team is already preparing with their protocols, like for a particular kind of cancer, what does the patient need? Similarly, we as patient can start having strong foundation of good mind, body, and spirit, put layers after layers of mental abilities, physical abilities to start preparing for this entire new journey. Hence, I want you to think about yourself like an athlete. We are just on a different journey and we are on our own journey, but let's prepare our mind and our body so that we come out stronger, more resilient, and more functionally able before, during, and after your cancer treatments. Research has shown that patients who get help early on, before starting the cancer treatments, they have had shorter duration of hospital stay. They have recovered from the cancer-related surgeries faster. They've had fewer side effects of cancer-related treatments. They have had much more treatment options, and they overall have better functional and physical and mental health after completing these treatments. So this pre-rehabilitation has been supported by research. What is pre-rehabilitation? Pre-rehabilitation, I think I'm missing one of my slide. Anyways, good news is that even if you have few days before your treatments are going to begin, or you have few weeks coming up to beginning of your treatments, all these components of pre-rehab are going to help you. They're going to make you stronger physically, mentally, and also give a lot of confidence to your own self, to your support system, to your caregivers. When your caregivers, your near family and friends know that you are embarking on this journey confidently with a lot more resilience, They are also more confident in supporting you during this journey. The overall support system becomes a lot stronger, and hence we want to start pre-rehab the day we know about our diagnosis. There are 4 steps to pre-rehabilitation. This is the theoretical aspect. Ideally, in ideal world, when a patient has been diagnosed with cancer, they should go through these 4 steps of pre-rehabilitation. They involve screening, assessment, intervention, and monitoring. It is very important for medical staff in ideal world to start helping the patient prepare for this journey. While they're preparing for the medical treatment protocol, as I mentioned early on, we want the staff to start helping us prepare for pre-rehab so we can come out stronger. Let's go on to know what these steps really mean. So going on to screening. Screening is ideally done by medical staff. It could be your nurse, it could be physician assistant, it could be the physician, it could be anybody on your medical team that screens you before they start you with cancer treatment. They screen you for your current weight, for your current physical abilities. They screen you for your current mental status or mental well-being, and they also screen you for current comorbidities. Do you already have pre-existing diabetes? Do you already have high blood pressure? Is there an ongoing infection? Is there an ongoing immunocompromised condition? These factors will help them help you better. Hence, the screening is really, really important. Sometimes the screening is missed. For example, if a patient with breast cancer has to go for radiation, it is very important for that patient to have full range of shoulder motion so the patient can lay there comfortably without hurting the chest or the back or the neck or the shoulder and get good exposure to the radiation beams. If this patient was not screened for shoulder range of motion, the patient might struggle or the radiation might get compromised. And hence, if the patient was screened well for range of motion, for the strength, it's going to help the patient and get the treatment done better. So this is where screening is very, very important. When we talk of assessment, we are talking of multimodal approach, meaning we have buffet of healthcare practitioners apart from a medical team who are taking very important decision to help us prepare for this journey. It could be your occupational therapist who comes to your house or brings you into outpatient clinic just to make sure that you are able to squat on the toilet better. For example, if a patient has been diagnosed with colorectal cancer, the patient might have a colostomy bag, or the patient might have a big scar tissue on the abdomen. And if this patient already has compromised abilities to squat well on the toilet, the patient needs a support or a chair to be placed even before the surgery so that the patient gets used to it, the patient is comfortable with the new chair, like the toilet support or the raised toilet seat, so the patient can go through the treatment during the surgery, after the surgery better. So the functional abilities of this patient, the physical abilities, which has been measured by the physical therapist, is your range of motion adequate for getting that radiation? Are you able to bend within your normal limits so that you can have good movement after you have that new scar tissue? Are you able to spread your legs apart well so your doctors can reach for that radiation beam in case of pelvic cancers? These are few examples how simple screening and assessment by healthcare professionals can make your journey better. This is ideal world. If this doesn't happen, we want to be our own advocate. We want to go and talk about the requirements that precedes the beginning of cancer treatment. And we want to see if we are able to move our neck better, our shoulder better, wherever that cancer is present, is that part functioning well? And if that part is not functioning well, what can I do to make it functional better even before I get the surgery? So that is your assessment If it's not done by the medical professionals, we want to do it. And then comes the intervention. There are certain interventions which are universal, no matter what comorbidities you have, no matter what kind of cancer you have. These interventions apply to all of us, and they include mental well-being, physical abilities, or improving your physical movements, and diet. These apply to all of us, and hence they're called universal intervention. And then comes specific or targeted intervention. In these, if you have a pre-existing deficit, we want to have one-on-one session with the PT. We want to have one-on-one session with the dietitian and see what can be changed. What can I improve so I can tolerate the cancer treatments better? So that's why we want to have universal interventions and targeted interventions. And then monitoring. Are these interventions working well for me? Are they helping me? Am I feeling like I'm going to be able to roll out of the bed better when I have that surgery done? Do I know that I can stand well, or do I need walker? So just monitoring where you stand, how you're progressing once you have these interventions given to you, and once you are using all of these interventions, and making necessary changes as you go through the treatment is also very important. So these are the steps to pre-rehab. In this series of 6 lectures, I am specifically going to target on universal interventions, some components of rehabilitation that can apply to all patients of cancer, or patients with any diagnosis of cancer, or patient who is having difficulties during the cancer treatment. Where can they start? So we are specifically going to target the universal interventions in the next few series. In summary, pre-rehab can be compared to starting and preparing for a marathon or building a house, because we are starting to lay strong foundation of good mental and physical well-being so that we can go through the journey better, not just after the journey is over, but before our journey starts, during a cancer treatment journey, and after completion of the cancer treatment, so we can thrive and not just survive. I'm hoping that this will be helpful and will help you to prepare better for your cancer-related treatments. If you have any questions, you can feel free to email me at my email, which is listed right here. You can know a little bit more about my work and my services at the website listed here. I'm hoping you're going to follow us through the remaining of this journey and the lecture series. Thank you.